name's Nemeth. I'm here today to talk to you about an important issue that's affecting our nation at the current time. This is the need for a nationalized health care plan. A national health care plan was first proposed by Franklin Delano Roosevelt during part of his New Deal. Over the last decade, employer-based insurance premiums have increased 131%. This is 4 times more than wages and inflation, which I also have shown on this little graph here to show this is the health insurance premiums, that long diagonal line. Here are the wages and inflation. Wages are at 38%, inflation at 28%. Currently, healthcare is the largest industry in our country, which employs 14 million people and makes up 16.2% of our economy. Healthcare is expected to increase by 6.2% per year, while the GNP, General National Product, is expected to rise at only 4.1%. So the amount to healthcare will become larger and larger. In just 3 years, Medicare and Medicaid will account for 50% of all national health care spending. The U.S. currently ranks number 1 in the world out of 193 nations in per capita healthcare costs. And yet we are 50th on the life expectancy rate. On this chart, I have a list of countries that rank a lot higher than the United States. You have Japan, Australia, Canada, France, Italy, Spain, and many other westernized countries. We are also one of few, if not only, developed nation that does not guarantee health care coverage for everyone. Many Americans who do not have health care coverage or proper coverage do not seek any wellness or prevention programs. Catching a problem before it gets too serious can cut costs of healthcare a lot. The wellness program can keep many healthier and avoid the higher costs when the person actually needs treatment for a problem. Many healthcare programs are preventable. There are several guarantees that the administration is talking about. In regards to the healthcare system, they would like to see a guarantee that when someone loses their job, they don't lose any coverage. They would also like to see that no one is denied for pre-existing conditions. Also, they would like that everybody has a choice for their own doctor. Reform that have been proposed will limit the amount of premiums that go to administration costs and overhead. Private insurance companies currently spend a lot of money, a lot less each dollar, on actual health care than government-run plans. They are in the business for higher profits and spend more salaries on trips, on overhead, and also general waste. Many people also of retirement age that are currently holding on to jobs just for the reason to pay for their prescriptions or any other healthcare benefits would then be able to retire, thus opening other jobs for other people, which would start a nice cycle for jobs. Regulations could also be set up which could cover the cost, the entire industry, to clamp down on any abuses by the insurance companies. This would lead to a more fair system where everyone is treated equally. Many who are uninsured will make visits to the emergency rooms for standard care or minor problems. If they have insurance, they would go to the family doctors who would charge minimal fees. Instead, they have to go to emergency rooms where they cannot be refused treatment, thus making the cost higher and making everybody else's insurance companies have to pay. Say, one example, healthcare costs at $1,525 to the price of every General Motors vehicle made, while Toyota spends $1,400 less on healthcare per vehicle. This makes it very tough to compete in a world market, and so jobs get lost. Small businesses have it worse. Since they are in a much smaller pool, they pay up to 18% more than larger firms due to the cost of a broker, administrative fees. How to solve some of this? By creating exchanges, which are pools of small businesses that together gives them increases purchasing power when it comes to healthcare. Many may complain that the government is incapable of running a problem this large. However, most people agree that Social Security runs fairly smoothly. Retired citizens receive their monthly checks, and doctors have no problem accepting Medicaid cards as guarantee of payment from the Social Security Department. They are confident in the system and get reimbursed for their services. Also, in regards to administrative costs, if a national healthcare system can cover many citizens and take the place of many small healthcare insurance companies, the cost to administer paperwork and process claims would be much less than if many companies each had their own departments that were considered overhead with many processing systems. That is why a national healthcare plan is needed for our country.